When assisting a client who is using the commode, it is important to A. Leave the call light within reach. B. Lock the door to promote privacy. C. Stand next to the client until the client is finished. D. Restrain the client to prevent a fall. Answer A. Ensuring the call light is within reach allows the client to request help if needed. Ensuring adequate circulation to tissues is a major factor in preventing skin breakdown. This can be accomplished by doing all of the following except A. Positioning the patient every 4 hours. B. Using mechanical aids. C. Giving back rubs. D. Performing active or passive ROM exercises. Answer A. Clients should be repositioned at least every 2 hours to prevent pressure sores. Every 4 hours is insufficient. The purpose of cold applications is usually to A. Speed the flow of blood to the area. B. Prevent heat exhaustion. C. Prevent or reduce swelling. D. Prevent the formation of scar tissue. Answer C. Cold applications help constrict blood vessels, reducing swelling and inflammation in the affected area. The hot water bottle is an example of A. Local dry heat application. B. Generalized dry heat application. C. Local moist heat application. D. Generalized moist heat application. Answer A. A hot water bottle provides localized heat therapy, which can help relieve pain and muscle tension. Clients receiving an enema are usually placed A. On the right side. B. On the left side. C. Flat on the back. D. In a semi-sitting position. Answer B. The left side position, Sims position, helps the enema solution flow into the colon more effectively. A female client's perineal area should be cleansed before which specimen is collected? A. 24-hour urine specimen. B. Midstream clean catch urine specimen. C. Pediatric routine urine specimen. D. Routine urine specimen. Answer B. Cleaning the perineal area helps prevent contamination of the urine sample, ensuring accurate test results. The most common site for counting the pulse is the A. Carotid artery. B. Femoral artery. C. Brachial artery. D. Radial artery. Answer D. The radial artery, located at the wrist, is easily accessible and commonly used for taking pulse measurements. When counting respirations, the nurse aide should A. Wait until after the client has exercised. B. Not tell the patient what he is going to do. C. Count 5 respirations and then check his watch. D. Have the client count respirations while the aide takes her pulse. Answer B. To ensure accurate counting, the patient should not be aware that respirations are being observed, as it might alter their breathing pattern. Which of the following is not the nurse aide's responsibility when caring for clients who have urinary catheters? A. Inserting the catheter. B. Ensuring that the catheter drains properly. C. Preventing infection. D. Recording urinary output. Answer A. Inserting a catheter is typically a procedure performed by a nurse or physician, not a nurse aide. When giving information to the charge nurse for an incident report, the nurse aide should A. Write in the client's chart that an incident occurred. B. Keep the report in her personal file. C. State the facts clearly. D. Give her opinions as to the cause of the incident. Answer C. Factual, objective reporting is essential for accurate documentation and follow-up. All long-term care nurse aides must be competency evaluated and must complete a distinct educational course. These requirements are set by A. OBRA 87. B. OSHA. C. CDC. D. FDA. Answer A. The Omnibus Budget Reconciliation Act of 1987, OBRA 87, established training and competency evaluation standards for nurse aides. A resident is blind. It is important not to A. Leave the door completely closed. B. Rearrange the furniture. C. Announce yourself before entering the room. D. Explain the location of food on the plate, using the face of the clock to assist. Answer B. Consistency in the arrangement of furniture helps visually impaired residents navigate their environment safely. When family members visit a client, the visitors should A. Stay in the day room. B. Stay a short while so as not to tire the client. C. Be expected to help with care. D. Be allowed privacy with the client. Answer D. Providing privacy respects the client's dignity and allows for personal interactions with family members. A resident asks, "If I need help during the night, who will be there?" The nursing assistant should respond. A. Don't worry, you'll be okay. B. Just yell, someone will hear you. C. Your roommate will probably ring the call bell. D. There are people here all night to help you. Answer D. Reassuring the resident that help is available at all times promotes a sense of security and comfort. Which of the following is a client's right? A. Having personal information kept confidential. B. Obtaining private duty staff if desired. C. Knowing what is wrong with the client's roommate. D. Treating the staff any way he or she pleases. Answer A. Confidentiality of personal information is a fundamental right of clients in healthcare settings. A resident often cries while she is receiving her PM care. What should the nurse aide do? A. Tell her to stop crying. B. Ignore her and continue with her care. C. Tell her jokes to make her laugh. D. Tell her that it's all right to cry and that the aide is there for her if she wants to talk. Answer D. Providing emotional support and acknowledging the resident's feelings are important aspects of compassionate care. When providing denture care, the nurse aide must A. Wash them in boiling water. B. Hold them under warm running water. C. Dunk them in and out of cool water. D. Place them on a towel in the sink with cool water. Answer D. Place them on a towel in the sink with cool water. Placing dentures on a towel prevents damage if they are accidentally dropped, and cool water helps prevent warping. Sexuality in long-term care clients may include all of the following except A. Needing private time with a partner. B. Caring about one's physical appearance. C. Engaging in public fondling. D. Desiring sexual interaction. Answer C. While sexuality is a normal part of life, inappropriate public behavior such as fondling is not acceptable in a care setting. A client is scheduled for a partial bed bath. This means that the nurse aide must wash the client's A. Face, neck, ears, arms, and hands. B. Face, axilla, hands, and buttocks. C. Face, hands, axilla, and legs. D. Face, hands, axilla, genitals, and buttocks. Answer D. A partial bed bath typically includes washing areas that may produce odor or where the skin folds, helping to maintain hygiene. A goal for an extended care facility (ECF) resident is that she not swear at the nurses or aides. When she calls an aide by his name, the appropriate action is to A. Smile and give the appropriate reward. B. Continue whatever task that is being done. C. Tease the resident about not swearing. D. Tell all of the staff that she didn't swear. Answer A. Positive reinforcement encourages the resident to continue the desired behavior. An agitated resident must be turned every 2 hours all night long. The first action of the nurse aide when waking up this resident is to A. Turn on the light. B. Speak quietly and calmly. C. Touch her shoulder. D. Shout her name. Answer B. A calm approach helps reduce agitation and stress for the resident. If a client objects to certain food for religious or cultural reasons, the appropriate action would be to A. Tell him to wait for the next meal. B. Offer to substitute something different for him. C. Call the dietitian the next day. D. Tell him he needs to eat what is on his tray. Answer B. Respecting religious and cultural dietary preferences is important for client comfort and well-being. The client's religion forbids eating pork. Bacon is being served for breakfast. The most appropriate response is to A. Encourage the client to eat it because she needs protein. B. Tell the client it is all right since her doctor ordered the diet. C. Call the kitchen for a tray without bacon. D. Tell the client that restrictions are not as important as her health. Answer C. Accommodating dietary restrictions respects the client's beliefs and preferences. Which type of communication can often be most powerful? A. Written. B. Verbal. C. Silent. D. Tactile. Answer C. Silence can be a powerful form of communication, allowing for reflection and conveying empathy or understanding. A client refuses to allow the nurse aide to bathe her. The nurse aide tells the client that she will not be allowed to eat lunch or go to bingo if she does not have her bath. This is an example of A. Rehabilitation. B. Discipline. C. Verbal abuse. D. Physical abuse. Answer C. Coercing a client by threatening to withhold basic needs or activities is considered verbal abuse and is unethical. On entering a room, an aide notices that the client is not breathing. The aide's first action should be to A. Call for help. B. Lay the client down on his back. C. Give 4 quick breaths. D. Give 8 to 10 abdominal thrusts. Answer A. Immediate notification for help is crucial in emergency situations to ensure prompt medical intervention. A client's dentures are lost. The first action should be to A. Notify the administrator. B. Look for them. C. Notify the doctor. D. Notify the charge nurse. Answer D. Reporting to the charge nurse initiates a protocol for searching and potentially replacing the dentures. Nursing assistants are responsible for A. Planning client care. B. Doing tasks assigned by the charge nurse. C. Performing without ever asking for help. D. Comparing assignments with coworkers. Answer B. Nursing assistants carry out tasks delegated by licensed nurses, within their scope of practice. A patient turns on the call light when he needs to urinate. The appropriate action is to A. Ignore the light, since he is not the aide's own client. B. Announce on the intercom that there are 2 patients ahead of him. C. Answer the call light and get the urinal. D. Answer the call light when the aide has the time. Answer C. Responding promptly to call lights is essential to meet the patient's needs and provide proper care. A client is on CMR and in the prone position. The nurse aide finds the client vomiting bright red blood. The nurse aide should first A. Clean up the vomit. B. Place the client in the side-lying position. C. Provide the client with an emesis basin. D. Call the charge nurse. Answer D. Reporting the incident immediately ensures that the client receives appropriate medical evaluation and care. When performing catheter care, the nurse aide should wash the catheter. A. Toward the meatus. B. With betadine soap. C. Away from the meatus. D. With alcohol. Answer C. Washing away from the meatus reduces the risk of introducing bacteria into the urinary tract. A nurse aide who applies restraints on a client without directions from the charge nurse may be accused of A. Slander. B. Battery. C. False imprisonment. D. Negligence. Answer C. Applying restraints without proper authorization or necessity can be considered false imprisonment, violating the client's rights. HS care is care that is given. A. Before meals. B. Before bedtime. C. After meals. D. Upon awakening. Answer B. HS or insomnia care refers to care provided at bedtime, often including personal hygiene and comfort measures. The best food choices for a geriatric client with no teeth would include A. Hamburger, French fries, corn, and ice cream. B. Baked chicken, dressing, green beans, and coconut macaroons. C. Spare ribs, macaroni and cheese, coleslaw, and fruit cocktail. D. Baked fish, whipped potatoes, spinach soufflé, and tapioca. Answer D. Soft, easy-to-chew foods are suitable for clients with no teeth, ensuring they can eat comfortably and safely. A client's family wants to talk about the client's impending death, but the client does not want to talk about it. The family should be encouraged to A. Carry on the conversation away from the client. B. Talk freely in front of the client in order to help the client to accept it. C. Wait until the client dies to talk about it. D. Force the client to talk about it with them. Answer A. Respecting the client's wishes regarding sensitive topics is important, and discussions can be held privately to honor their preferences.